Ohio is fighting a battle against addiction. Thanks for joining us. I'm Colleen Marshall. Ohio Senator Rob Portman is sounding an alarm over the rising number of overdoses in the state. Now he's part of a growing chorus of lawmakers working to fix the problem. There are now Senate and House bills that will fund grants to combat abuse, improve treatment, and bolster some law enforcement programs. And they're winning support from members of both parties. Portman talked to us about the goal this week.
Yeah, I just finished testifying before the Senate Judiciary Committee on our legislation called CARA, the Comprehensive Addiction and Recovery Act. I thought it went really well. The chairman of the committee and the top Democrat in the committee are not co-sponsors yet, although we have 9 people on the committee who have co-sponsored it. But they both said the right thing, which is after our testimony, they thought that this was an important issue that needed to be addressed and that they're interested in moving forward on this, meaning the next step, which is to actually report out legislation that would then go to the floor of the Senate. We've also got a companion bill in the House, so I think this can get to the President's desk, and I think he'll sign it. And I think it should happen in the next few months, and we can really begin to address this problem. I think it's the right response to a very real problem in every community in Ohio, which is this increasing prescription drug and heroin addiction issue.
Portman says the bill will include a range of approaches to treat Ohio's addiction problem.
And our legislation is a comprehensive way to look at it. We've brought in groups from around the country to help us on it over the last few years, from education and prevention through treatment and recovery, helping law enforcement, helping ensure that the communities back home that are doing a good job in addressing this get more help to be able to get more people into prevention programs and into treatment programs to actually begin to turn this around.
Portman says the drug crisis in Ohio simply cannot be ignored.
You know, we are losing about 20 people a week to heroin overdoses. In other words, people are dying from these overdoses. That doesn't count the number of people who are saved from dying by our courageous first responders, our police officers who get to them and are able to use naloxone and help them to be able to survive the overdose. But even so, these people are addicted. They're having a tough time holding down a job, taking care of their family. They're committing crimes many times to feed their habits. So this is a huge problem.
The bill has received bipartisan support.
I'm encouraged that we have bipartisan support for the legislation. Look, it's affecting every single state in America and really every community. We do have some people who are concerned about the cost, others who might be concerned about the role. And what I tell them is 2 things. One, it's a very small investment for a huge return. If we can begin to turn the tide here, this will save our country billions of dollars a year. More importantly, it will save us going through this human cost of people getting addicted, of not being able to follow their dreams and having their lives ruined. So I think it's the right way to go. In terms of the federal role, look, it's going to actually be solved at the local level, I believe, and I think that's important. But local government and state government need our help right now, as do nonprofits. They want to know what's the best science, what's the best way to deal with both prevention and treatment and recovery. They need to know what's working around the country. We can do that through the federal level. Second, we're going to be providing incentives for states to get into programs we know work. That includes effective prevention. It also includes effective programs to monitor prescription drug use, effective programs to do the take-backs to get prescription drugs off the shelves that, unfortunately, people are finding and using and abusing and getting addicted by. It's going to focus on how do we be sure that the recovery programs out there are science-based, evidence-based. We're going to provide incentives for states to turn to that. So I think this is a really important role for the federal government. It's an epidemic. It's all over the country. It's certainly affecting us in Ohio.
The money that will